So thank you. And the title of my talk today is Community Distress in COVID-19, a study of Bronx County older adults' emotional well-being. So to begin, I want to orient us to the timing of some of the early outbreaks of COVID-19 in the New York City area. On March 1st, the first case of COVID-19 was reported in New York City in Manhattan, just south of Bronx County. On March 3rd, the first confirmed COVID-19 case was reported in Westchester County, just north of Bronx County. And on March 12th, New Rochelle, which is a city located in Westchester County, established a containment area to prevent the spread of the virus. And this is meaningful because, as you can see in these maps, the containment area in New Rochelle is only a few miles from the edge of the Bronx, and participants in this study were recruited from throughout Bronx County. And as we know, the number of cases increased rapidly, and on April 15th, the number of new cases reported on a single day in New York City peaked at just over 8,000 new cases. So the study I'm presenting today is the Einstein Aging Study. This is an ongoing longitudinal study of older adults living in Bronx County. Data collection for this study began in 2017, and the age range of participants is 71 to 94, and with a mean age of 77. This study uses a measurement burst design, which means that participants completed a 14-day ecological momentary assessment, or EMA, an EMA period at each burst. And bursts are similar to waves of data collection, but the term burst is used because during these 14 days, participants complete self-report surveys 6 times every day. So we collect a lot of data across these 2 weeks. These bursts are then separated by approximately 1 year. And so we can capitalize on this design to address a natural experiment among these participants that are demographically at risk due to age and geographically at risk due to living in the Bronx. Therefore, we asked the question whether participants would report worse emotional well-being during the COVID period compared to what these participants reported when asked the same questions before COVID. And measurement burst designs are useful because they're sensitive to state changes, such as one's emotional fluctuations across the day. So the images on the right side are screenshots of the self-report survey that participants complete each day during the burst. And as you can see, we can ask about emotions and social interactions that are likely to vary during the day. These surveys limit retrospective bias as participants are asked to report their emotions right now or recall over the last few hours instead of having to recall over the last few weeks or last few months of their lives. Additionally, patterns of response both within each day and across the 14-day burst can be compared with later bursts a year or 2 years later. So specifically, because of COVID, we asked the question of how participants' emotional well-being was impacted during the outbreak. And even early in the pandemic, organizations such as the World Health Organization and news media outlets were communicating that older age was a risk factor for severe health risk due to COVID. Given that the message of age as a risk factor for severe outcomes was present early in the American pandemic, how did this information impact participants' emotional states? So in a preliminary analysis, a subsample of 78 participants were identified as having completed an EMA burst pre-COVID and during the COVID period. The pre-COVID period was defined as being between December 15th, 2018 and October 22nd, 2019, while the COVID period was defined as being between February 22nd, 2020 and June 15th, 2020. In this analysis, we focused on the question shown here in the screenshot about how unpleasant or pleasant a person's thoughts have been since the previous survey. As a note, although there are participants that completed EMA periods before December of 2018, we limited the pre-COVID period to roughly capture the year before the pandemic began. These preliminary analyses showed that on average, thought unpleasantness did not change among participants from the pre-COVID period to the COVID period. However, personality traits of participants were significant, such that participants low in extroversion and high in neuroticism showed increased thought unpleasantness during the COVID period relative to pre-COVID reports. And so in the analysis that I just described, participants' EMA assessments were categorized as either being completed before COVID or during COVID. But how can we measure the unfolding pandemic? So for example, the prevalence of COVID cases in New York City is much lower now than it was in March. So the context was different for participants that completed their EMA assessments recently, such as in September, compared to participants that completed an EMA assessment back in March or April. So in addition to collecting self-report survey data via smartphone about emotional well-being, we can use publicly available Twitter posts to quantify the community indicators related to COVID-19 in a specific area at a specific time. So in this figure, you can see that the date is listed along the gray line. And on specific days, we can see that various Twitter users make posts that are represented by the black diamonds. And we can collect these timestamp tweets. Based on the content of these tweets, community indicators related to COVID, such as mentions of COVID-19, anxiety, and emotional valence, can be quantified from the tweets. With this approach, we can measure how these community indicators have changed across time, as represented by the hypothetical lines for each of these terms, where mentions of COVID-19 may increase across the time period, as shown here. Importantly, these tweets come from Twitter users that are located in the Bronx or Westchester counties and are not restricted to our participants. Once the community indicators are extracted from Twitter, these indicators are aligned to the 14-day period when participants are completing their EMA assessments. So for example, a participant that completed their EMA assessment during January, such as this participant, can be matched to the community indicators of anxiety and COVID-19 during January, and whereas another participant that maybe completed their EMA assessment during March can be matched to the community indicators during March. And so this approach has been adopted to more specifically track how COVID has impacted the Bronx and Westchester communities over time. Analyses of Twitter posts can be used to zoom in and characterize the community and context around participants, during a given time. In preliminary analyses, we saw differences in emotional well-being related to personality traits. And so we can drill down even further to ask how stay-at-home orders or limited social interactions may have impacted people differently depending on their personality traits. And lastly, we can ask more questions like, how might personality traits be related to COVID policy changes, like the closing and reopening of businesses, the spread of the virus around the country, and other factors such as the social and political climate of the past 7 months.
Giancarlo, I think we're out of time. We can take a couple of minutes from the questions, but
perfect. I'm just about done too. I just want to say thank you to everyone that is working on this project currently at Stony Brook, Penn State, and Central Florida, and of course to the team at Einstein that's located in the Bronx, along with participants. So I have some contact information here, and happy to take any questions.